I'm Dr. Farion Williams from the University of Illinois College of Medicine at Rockford, and I'm a professor of family medicine and medical education. So family doctors, their specialty in treating patients is, first of all, prevention. So I think when we think about working with patients who might develop cancer, who have risk factors for developing cancer, we need to work on decreasing their risk. So for example, tobacco is probably the leading cause of cancer in the world. And if we look at cancer formation here in India, 40% of all cancers stem from tobacco use. So working with patients to no longer use tobacco, I think, is one of the biggest things that we as family doctors can do. Other things to work in prevention is in decreasing alcohol consumption, also in working on dietary changes as well to promote more active, healthy lifestyles. Those are some things that we can do as family physicians consulting with our patients and counseling them in these areas. Once we've done that, the second thing to do is to screen for cancers. The top 3 cancers that we see here in India are breast cancer and cervical cancer in women, and then also oropharyngeal cancer in men and women both. Those are the 3 most common cancers. So screening involves having the patient go to their doctor and having screening tests performed to see if they are having evidence that cancer is starting to develop. It's important, if we find the cancer in the early stages, then there's a chance that the cancer can be cured and that the patient won't have to have further suffering. Once a cancer has spread, then of course getting the patient to see a cancer doctor if they so choose, starting various treatments with the oncologist. But one of the things that the family doctor can do, even though they've reached that stage, is offer palliative treatments, such as trying to relieve their pain that they might have, helping them with any side effects from the treatment, such as nausea, vomiting, working to help relieve any pain or suffering that they might have in relation to the treatment. Those are things that the family doctor can do. So the family doctor would refer to the oncologist once a cancer has been identified. Okay, so once, for example, there are things family physicians can do, such as in the case of cervical cancer, if the family physician was skilled and it was localized, a LEAP procedure could be done, cryotherapy could be done for precancerous lesions. But once the cancer has been identified as having spread, then you would refer the patient to the oncologist. Well, one of the things that I think communities can do is work to develop education programs, for example, in getting the word out about the dangers of tobacco, trying to decrease tobacco consumption. I think that's probably the most largest aspect of things that we can do for prevention. Being able to, for healthy lifestyles, to increase activity. Some communities might put more walking paths, things where individuals and families can get out and enjoy, physical activity.